Biostatistics made easy, navigating multivariate analysis in health research. Hello, everyone. Welcome back to the channel. I'm Myada, and in today's video, we're tackling a key concept in health research: multivariate analysis. Multivariate analysis can seem intimidating at first, but it's an incredibly powerful tool for clinicians and researchers. By the end of this video, you'll understand what it is, when to use it, and how to interpret it in your own research. Let's get started. In simple terms, multivariate analysis is a set of statistical techniques used to analyze data that involves more than one variable at a time. Unlike univariate analysis, which focuses on one variable, multivariate analysis lets us understand the relationship between multiple variables and their combined impact on an outcome. This is especially useful in health research, where we often deal with complex datasets involving multiple risk factors, confounders, and outcomes. Multivariate analysis, analyzing multiple variables simultaneously to understand their relationships and combined effects. There are several types of multivariate analysis techniques, each suited to different research questions. Here are some of the most common ones. 1. Multiple regression analysis, used to predict a continuous outcome based on several predictor variables. 2. Logistic regression, used when the outcome variable is binary. 3. Cox proportional hazards model, commonly used in survival analysis to assess the impact of multiple variables on time-to-event data. 4. Multivariate analysis of variance, MANOVA, used when there are multiple outcome variables and you want to assess the impact of several independent variables on those outcomes. 5. Principal component analysis, PCA, a technique to reduce the dimensionality of large datasets by identifying key components that explain the most variance in the data. These are just a few examples of the wide range of multivariate techniques. The key is to choose the right method based on your research question and data type. In health research, you'll use multivariate analysis when you're interested in understanding how multiple variables interact and influence an outcome. Here are a few scenarios. Adjusting for confounding factors. Suppose you're studying the effect of a new drug on heart disease. You know factors like age, gender, and smoking status could also influence the outcome. Multivariate analysis allows you to adjust for these confounders to isolate the drug's effect. Exploring complex relationships. Imagine you're researching diabetes and want to examine the combined effects of diet, exercise, genetics, and medication. Multivariate analysis helps you explore these complex relationships simultaneously. Predictive modeling. If you're trying to predict which patients are at higher risk for complications after surgery, multivariate analysis can help you build a model incorporating several risk factors. By considering multiple variables at once, multivariate analysis provides a more comprehensive picture of the relationships in your data, leading to more accurate and meaningful results. Now, let's talk about interpreting the results of multivariate analysis. While the output can look complex, the key is to focus on a few important elements. 1. Coefficients. Beta. These represent the relationship between each predictor variable and the outcome, adjusting for the other variables in the model. In linear regression, for example, a positive coefficient means an increase in the predictor variable is associated with an increase in the outcome. 2. Odds ratios or hazard ratios. In logistic regression or survival analysis, coefficients are often presented as odds ratios or hazard ratios. These tell you how much the odds or hazard of the outcome changes with each unit increase in the predictor variable. 3. P-values. These indicate whether the relationships observed are statistically significant. A p-value less than 0.05 usually suggests that the relationship between the predictor and outcome is not due to random chance. 4. Confidence intervals. These give a range of values within which the true effect size is likely to fall. A narrow confidence interval indicates more precision in your estimate, while a wider interval suggests more uncertainty. Remember, the interpretation of your results should always be guided by your research question and clinical context. Just because a variable is statistically significant doesn't necessarily mean it's clinically important. Let's walk through a real-world example. Imagine you're conducting a study to determine the factors that influence the development of hypertension in patients. You collect data on several variables, including age, BMI, physical activity, and salt intake. After performing a multiple regression analysis, you find the following. Age, coefficient equals 0.03, p-value less than 0.001. BMI, coefficient equals 0.05, p-value equals 0.002. Physical activity, coefficient equals minus 0.02, p-value equals 0.01. Salt intake, coefficient equals 0.04, p-value equals 0.04. From this output, we can interpret that age, BMI, and salt intake are positively associated with higher blood pressure, while physical activity is associated with lower blood pressure. The p-values suggest these associations are statistically significant. But don't forget to consider the clinical significance. For example, if increasing physical activity reduces blood pressure by just a tiny amount, the clinical relevance might be limited, even if the result is statistically significant. To wrap up, here are the key takeaways. 1. Multivariate analysis allows you to analyze multiple variables at once, providing a more complete understanding of your data. 2. Choose the right method based on your research question and the type of data you have. 3. Interpret results carefully. Focus on the coefficients, odds ratios, p-values, and confidence intervals, but always consider the clinical context. Multivariate analysis is a powerful tool in health research, helping you navigate complex relationships and make more informed decisions in patient care. Thank you for watching. If you found this video helpful, give it a thumbs up and subscribe to the channel for more tips on biostatistics and health research. If you have any questions, feel free to drop them in the comments below. See you in the next video.